Okay, so we're at the login page and app.mycopayapp.com is going to bring you right here. If you don't have an account, you're going to create the account. It's super simple. You're going to pick the gold plan. That's going to give you 3 months free. It does ask for credit card information like every other website, but as long as you cancel within 30 days, you will not be charged. I also have it set up so you will get the 30-day reminder before it renews. This way, if you want to cancel, you absolutely can cancel. So let's log right in. Very easy once you have everything set up. And the creating of the account takes all but maybe 2 minutes, literally. I'm a manager myself, and I don't want to deal with anything extra. So this is going to pull it right here. I'm going to move me down here. You're going to put in the name. If you don't want to put in the date of birth, who cares? What I do at my office, and I make sure that I have implemented, I do not rely on any software for insurance eligibility checking. It's not up to date at times. It's not correct. It doesn't give you frequencies, a lot of things. So your safest bet is to go right to the portal, like the day before the service, just to make sure anything could have happened in between, right? So this patient, me, I have a $2,500 deductible. I've used 450 to date. That's what the portal is showing me anyway. I have a $50 deductible. I have not met anything to date. I need a four surface filling. It does downgrade, alternate benefit apply. That's another way that they put that in there. 2161 is what that's going to downgrade to, and that's going to downgrade to $95. My deductible is already going to be in there because it's generating, and I'm covered for basic at 80%. However, my next appointment, I need a post and a crown. So I'm deciding that I do not want to wait for the predetermination. So, with that being said, when a patient does not want to wait for the predetermination, the safest bet is to put in the downgrade anyway. You're going to want to downgrade to 2791. That's your safest bet. That's base metal. Okay. So they're going to pay 625 on that. I have 50% coverage, all different kinds of percentages you could do in here. I'm going to need to put in my post, which is not going to downgrade. I've never seen a post downgrade. If somebody has, let me know because that would be pretty interesting. As you can see, we have all different percentages in here, deductibles, maximums. You're just going to hit that simple button, calculate. You're going to get everything right here. Okay, everything. You're going to be able to tell them that right there on the spot. Now, let's get to the really cool part. In Dentrix, which is the software that I use, the treatment planner is super confusing. Patients get confused, then you become, well, I didn't know that I had to pay this, and you told me that I had to pay this column, and it's just too much. So this gives it the basic breakdown. You have your maximum, max use to date, individual deductible. The patient can see everything, the codes that we're using, what it downgrades to, if it even downgrades, the fees that are applied. This gives you guys, the patients, full responsibility. You can call the insurance company. You can double clarify, double check that our fees are correct. You can make sure that it actually does downgrade. If it doesn't and you see that it's in there, you can call the office and let them know I absolutely do not have downgrades. I called and checked. Or all of this is going to be correct. You're going to be perfectly fine. Now, for those of us who use iPads and Kindles, if the patient is in the chair and we have to do this resin composite, we're going to want to do it really quick. You can also log into the website from your Kindle and from your iPad, and you can use, I think, 10 I made operatories available. So the email up to 10 times. Absolutely. There's no max on that, right? So let's say they're in the chair. You want that consent signed. Here's your consent sign button. Okay. You're going to save that and it's going to save. If the patient is not getting the treatment done and they want it emailed to them, I have my staff absolutely save this to the document center as a PDF. I want it in there. I want to be able to see it. So I will save it under Danielle, import it into the document center of my dental software, which I use Dentrix. save it under insurance eligibility. This way, you're always going to have it. Okay, so that's for that. And then, of course, if the patient wants it right on the spot, I have no connection with any dental software because if the software glitches, I don't need my software glitching. So I have made it, we can still continue to make money and do copays correctly without relying on anything. You simply put the email that you want in there and you send it, and the patient is going to get something from my insurance app with this attachment. You're going to open it and you're going to be able to see. And everything is really that simple.